Vanakkam. Good morning, everybody. I am Dr. Rithesh. I am the neuro intervention person in the SIMS Institute of Neuroscience. This week, October 29th, we celebrate World Stroke Awareness Day globally. So, incidence of stroke is every year increasing, and we have often seen in last 2 decades more and more young patients are getting involved with stroke. So, what is stroke? There are two types of stroke. One is when there is a bleeding inside the brain, usually due to high uncontrolled blood pressure, or when there is blockage to the artery going to the brain, which is more commonly caused by uncontrolled diabetes, smoking, excessive cholesterol. There is a family history of stroke. So these patients who has a family history of stroke, these persons who has family history of stroke or diabetes should have a regular blood checkup, health checkup every year. The incidence of stroke, as I already mentioned, has increased in last 2 decades, particularly because of lack of physical activity, sedentary lifestyle. So we have to be more physically active, at least weekly, 4 5 days a week, 30 to 40 minutes we should do regular exercises. The risk factors are usually diabetes, high cholesterol, uncontrolled blood sugar, uncontrolled BP, and higher incidence is seen in those with family history. So, what are the symptoms of stroke? The symptoms of stroke, we should be very aware. There is a global campaign going for last 25 years, which is the short form is FAST, FAST. So, in last 5 years back, we added B FAST, BE also. So, I'll just explain briefly through that. B stands for sudden lack of balance, giddiness, or any blurring of vision, eye symptoms. F stands for any deviation of the angle of mouth or the face going to one side. A stands for difficulty in raising the arm. S stands for difficulty in speech or conveying or language. And T stands for that we have to take immediate action. Time is very crucial. Why time is very crucial is the golden hour concept. Up to 4 hours, if the patient comes with a stroke due to a block in the artery going to the brain, we can give a clot busting agent and we can open the artery. Now, with the advancement of technology in last 1 decade, even with angiogram, we can open the artery going to the brain in selected cases up to 24 hours. So these need immediate imaging, brain imaging or scans, which is very commonly available in a city like Chennai. So we should go to a center with an advanced stroke unit where this advanced imaging is done, and we should find out whether the artery is blocked, and up to 24 hours we can open this artery and patient have a good recovery. Next, the other modalities which improve the quality of life for a patient is rehabilitation. So rehabilitation plays a very crucial role in the post-stroke recovery. So we should be adhering to the rehab protocol for the next 2 to 3 months. So the caregivers also has a big role to play, like preventing any aspiration or the food going choking in the lungs causing infection. So there is a solo assessment, there is a motor assessment. So it is a teamwork. So after the post stroke, next 2 to 3 months, the caregiver, the family member, and the person affected with stroke has to have a good rapport with the rehab center, and they should stick to the protocol advised by them. Generally, the message is stroke is treatable. It's not like 3 decades back. When the patient or the family recognizes that patient has a stroke, immediately go to a center with all the advanced treatment modalities, and we should not delay going to a stroke center because time is very precious. So that is the message we should, as a team from SIMS Neuro Institute, we should convey to the public that stroke is treatable with adequate timely treatment.